Welcome to Catonsville Electrolysis. My name is Carrie. In this consultation, we're going to touch on several things, including what to expect from treatment, hair growth stages, modalities, contraindications, preparation for your appointment, and so on. As I said, my name is Carrie. I'm a licensed electrologist and a lifelong Catonsville native. I'm also an electrolysis patient myself. Catonsville Electrolysis was established in 2024. We're currently using the Silhouette Tone Evolution XHD epilator, which has 3 frequencies in one machine. So what is electrolysis? Electrolysis is permanent hair removal that uses electrical energy or current to destroy the hair's germinating cells, eliminating the hair's ability to regenerate. It is a process. It is not a one-time procedure. So what can we expect? In electrolysis, we slide a pre-sterilized single-use disposable probe down the naturally occurring opening of your hair follicle. We are not piercing your skin. Depending on your sensitivity level, you may not feel the insertion. Our hands are washed and our instruments are sterilized. The hair should be removed without resistance. There are 3 different phases of hair growth. Anagen is the active growth stage. It is the stage where permanent hair destruction will occur. Unfortunately, electrologists aren't magicians and we can't see underneath your skin. In the catagen stage, the hair is transitioning. It's no longer actively growing, but it's not detached from the follicle just yet. It transitions upwards and the papilla is beginning to separate from the follicle. If the hair is treated in the catagen phase, it may damage the papilla, but not completely destroy it. It will regrow thinner and finer. In the telogen phase, the hair is separated from the follicle and it's resting, waiting to be pushed out as the follicle returns to the anagen phase. There are 3 modalities we can use in electrolysis. Thermolysis uses high-frequency alternating current to vibrate the saltwater molecules in your tissues to produce heat to destroy the hair follicle. Thermolysis uses lower times. It functions in hundredths and thousandths of a second. In galvanic electrolysis, we use direct current to rearrange the saltwater molecules in your body to produce a chemical reaction, creating a very small amount of what we call caustic soda. Caustic soda is also known as lye. This caustic soda is used to destroy the hair follicle. A longer time is needed to create enough lye along the probe. A galvanic electrolysis is in seconds to minutes. For the blend, we combine both thermolysis and galvanic electrolysis. When used in combination, thermolysis increases the amount of caustic soda produced by the galvanic current. For straight or wavy hair, the probe can reach to the bottom of the follicle with no problems. In curly or coily hair, you can see if we insert the straight probe into the follicle, it will not reach the papilla. This is when we would use either galvanic or blend because the caustic soda that's created is able to flow to the papilla, so we can achieve destruction. With treatment, you may experience discomfort ranging from a mild heat sensation to stinging or burning. If using a numbing agent, please follow the directions and give the proper amount of time for it to become effective prior to the appointment. Unfortunately, I am not able to apply the numbing cream to you. There may also be some redness or swelling, a light scabbing or pustule reaction. A pustule reaction is just a pimple. Everyone is different with how their skin reacts to treatment. Even from appointment to appointment, the same person can have a different reaction. With long and sometimes intense work, a slight weeping of the follicles can happen. Electrolysis can be performed on any skin type or hair type, but there are some contraindications to treatment or health concerns that require medical clearance. In other cases, electrolysis can be performed, however, the modality must be thermolysis only. For example, controlled epilepsy requires the modality to be thermolysis only, as the direct current in galvanic or blend may trigger a seizure. Local contraindications. For example, we'd again only use thermolysis on a person with metallic occlusions because the galvanic current seeks the path of least resistance. And if we're working on a face and the client has a permanent retainer, the current may go to the retainer instead of the inactive electrode in their hand. In preparation for your appointment, we want you to be hydrated both inside and out. Please avoid the use of caffeine. I won't deny anyone their coffee, but what I would ask is that for every cup of coffee that you have equal or more water. We would like you to gently, mildly exfoliate your skin and use pH balanced products. By exfoliate, I mean just the use of plain soap on a wash rag is enough to exfoliate your skin. What we're looking for here is to make sure that there's no dead skin covering your follicle that we're trying to get into. The hair itself does need to be long enough to be treated. Generally, an eighth to a quarter of an inch is plenty long. If it's shorter than that, we do risk pushing the hair back into the follicle with the probe that we use. So please let it grow. In addition, plucking, waxing, and threading all cause blood to rush to the area to heal what has been forcibly removed. This increase in blood supply can actually increase hair growth. We'd also like you to avoid the sun for 48 hours prior to treatment. This is basically anything that you may incur that irritates your skin prior to an appointment, we don't want you to do. Electrolysis itself mildly irritates your skin, so we do not want any irritation beforehand. There are several factors that can impact hair growth, including hormonal imbalances such as polycystic ovarian syndrome or PCOS, thyroid disorders, Cushing's syndrome, medications such as steroids or oral contraceptives, estrogen, testosterone. These can all impact hair growth, as well as a family tendency or ancestry, rapid weight loss or gain or obesity, extreme stress, idiopathic hirsutism, as well as laser treatments. In some people, laser treatment can actually cause something called paradoxical hirsutism, where what you're trying to treat and remove actually worsens because of the laser treatment. And we're to the question what everybody wants the answer to. How long will it take? I can't give you a definitive time frame because the duration of each period varies based on client availability, budget, and tolerance. There are different phases of treatment. In the clearing phase, we're treating each hair for the first time. In the control phase, we're treating regrowth. Regrowth would be those hairs that we treated in the telogen phase that were damaged but not completely destroyed. In the maintenance phase, we're down to low pilosity. Pilosity is basically the density of the hair. You can think of it as how many hairs per square inch. It's possible that during the control period, an increase in pilosity occurs. This could be due to hormonal changes, medication changes, an increase in stress, many different factors. If this does happen, we simply go back to the clearing period until you have these hairs removed, and then we resume the control sequence, which is where you were previously in the treatment. We do have some post-treatment do's and don'ts. After treatment, I'm going to apply a healing lotion to your skin. We ask that you keep the area clean and use a mild cleansing agent. And if you're going to be out in the sun, apply sunscreen. For post-treatment don'ts, if there is any scabbing, do not pick at it. Make sure to stay out of pools and hot tubs for at least 2 days. There is potential that you could introduce bacteria into your skin with pools and hot tubs, so you want to avoid that. Do try to minimize your sun exposure. We've mildly irritated your skin, and the sun, if you spend time in the sun, it's going to irritate it more. No facial peels for at least a week, and no retinols for 3 to 5 days. I'd love to provide answers to any questions that you may have.